Hello, friends. A common question I get is whether intermittent fasting has negative consequences on the body. Here's a recent study alleging that intermittent fasting increases your risk of cardiovascular disease and death, such as heart attacks and strokes. So let's go over this one. This is a study that was reported in a cardiovascular conference. So the first thing to note is that this is a poster only. It's not a randomized controlled trial and it's not a peer reviewed study, but it's gotten a lot of attention. What did they find? They studied 20,000 adults and they compared people who ate an 8 hour or less feeding window to people who have a normal 12 to 16 hours per day of feeding. And what they found is that people who had this lower feeding window, which is often referred to as intermittent fasting, had a higher risk of cardiovascular disease. Now, what exactly are the numbers underneath this? They followed people for 8 years. They look back at data over 8 years to see how people's health changed during this time. So they report what's called a hazard ratio, which means a kind of risk of things happening of 1.91, which means that in the overall sample, the people in this 8 hour feeding window had a 91% increased risk of cardiovascular disease, which goes up to 107% increase if you just look at the people who have cardiovascular disease already. And then if you look at the people who have cancer, it's 204% increase. Now, these can be shocking numbers, but if you look a little more closely into the data, I think there's reason to be skeptical about this. So first of all, we don't know anything about what's causing this. So the study doesn't address underlying mechanisms. That's obvious because this is more of like a cross-sectional or longitudinal type study. It's not a randomized controlled trial, not one of these placebo-controlled trials either. And here's one of the first reasons that we should be skeptical. So the time restricted group had more smokers in it. So the group of people who are eating 8 hours or less had more people who smoke in it. And people who smoke have more cardiovascular disease. Of course, this observed effect could have been because of the smokers that are more overrepresented in the time restricted group. The other thing is that it looks like the time restricted group had more men, and men have more cardiovascular risk than women because of various hormonal factors and other factors. So just by having more men in your group, you're going to have a higher risk of cardiovascular disease. So those are two confounding variables that make me a little bit suspicious about this finding. And for example, this person says, I would strongly anticipate that once the appropriate corrections are made, the finding will no longer persist in statistical significance. That's similar to what I'm suggesting. And of course, they say that more rigorous research is needed, but that's like the boilerplate thing in any journalism regarding a clinical study. They always say more research is needed. Let's look at another overview of this study. This is from the American Heart Association, where they try to go over the same study. And here they basically report similar data. But let's try to dig into a little more detail here to try to understand what other caveats we might have about this study. Okay, so in a little bit more detail, we see that time restricted feeding did not reduce the overall risk of death from any cause. And that's interesting because previous studies had suggested that time restricted feeding would be overall much better for people's health in terms of other metabolic risk factors. And what they're suggesting is that it's crucial for patients, particularly those with pre-existing heart conditions or cancer, to take heed of this study. So let's look a little more deeply into this. The other main limitation of this study is that it included reliance on self-reported dietary information. And self-reported dietary information is not as reliable as when people actually can observe what people are eating. So we don't really know if what people self-reported is different than what they did actually consume. The other thing is that people who elect to organize their nutritional intake in a way that's intermittent fasting are different from people who would on their own eat 16 to 12 hours a day. They're just different types of people. So those differences between those two types of populations are not accounted for in this study. So again, self-reported dietary information is limited because people's memory or recall may not accurately assess their typical eating patterns. And the other thing is that the nutrient quality of the two different groups may have varied. So as this person says, the nutrient quality of the diets typical of the different subsets of participants is really an important factor. Without this information, it cannot be determined if nutrient density might be an alternative explanation to the findings that currently focus on the window of time for eating. So what that means is that it looks like this time window effect is what's explaining the differences in cardiovascular outcomes, but it could be that there's differences in nutrition between those two groups that are confounding the results as another explanation for the results. There's other variables that are not even mentioned that could have explained this effect. So, for example, it's going to be critical to see a comparison of the demographic and baseline characteristics across the groups that were classified into different eating windows. So, for example, weight, stress, and traditional cardiometabolic risk factors and other factors associated with these negative cardiovascular outcomes. So, what that means is that there's a bunch of other factors that were not even discussed that could have been different between the two groups. So, differences in smoking, male and female differences in representation, and differences in nutrient quality between the groups. And then finally, biases and self reporting of nutrition from memory. Those are all four reasons to be suspicious of this study. So, overall, I would not interpret this study to mean that people should not do intermittent fasting. Number one, it was not a randomized controlled trial. It was not placebo controlled. It was one of these cross-sectional slash longitudinal lookbacks, which has a lot of bias towards confounding variables. And those confounding variables that I've identified here with you are very commonsensical. Differences between the groups and other factors not described. So I hope this helps you try to make a decision about how you think about intermittent fasting for your own life or those you love. Thanks very much.